Welcome to Medical Mondays, a 12-part, once-a-month series where we try to tackle the most common medical issues seen and experienced by cruisers. In our second episode, we are going to be dealing with how to do CPR, when to do CPR, how to take basic vitals, and finally, what Good Samaritan laws and maritime laws have in common, and what it means for you legally if you decide to help somebody who's in trouble out in sea in an international country or in international waters. Now, before we get started, I just want to say two things. One, I'm not a lawyer, so the information about Good Samaritan laws and maritime law and everything that we're going to be discussing today are things that I found by research, and you do want to go talk to a real lawyer if you are unsure of what to do and what not to do. The second thing is, this is an aid. This is not certifying you for CPR officially. So if you want to take a training course, there are dozens and dozens and dozens. Red Cross does them. There's a lot of online training simulations, especially from the Red Cross, that I think is about $30. So go do that. This is not a training video per se. This is an educational video, and this is to help clarify any questions you have. So that disclaimer out of the way, let's get started. To practice CPR, the first rule is don't practice CPR on a person who is awake, has a pulse, and is okay. So unfortunately, this is not something that you can full-on practice on your crew or on your partner. Instead, for today, for practicing, we've got our back cushions, which are actually made up of firm foam, and so they give a good feedback when you're actually pushing down, so you get to feel how tired and exhausting you feel after doing even 2 minutes of CPR, and why in all the training videos and in hospitals you see doctors and nurses and everybody who's doing CPR switching off every 2 minutes. So let's get started. So when do you do CPR? You do CPR on a person whose pulse has stopped, and I guess the next great question is, how do you take a pulse? So most people sort of have seen it on TV when someone rushes up and they check their neck and it's somewhere in this area. So basically, you've got a big muscle called the sternocleidomastoid muscle, and right in front of it, right here, with your two fingers, so your thumb has its own pulse, so you're going to be listening to your own pulse, so don't take a pulse with your thumb. Take it with your two index and second fingers, and just feel for it. And even as I'm talking, it's very hard for me to get my own pulse, so I probably need to stop talking to check it. But there's one on either side. Don't ever check both at the same time, because what you're checking is an artery, and those are two big arteries going to supply your brain. So if you ever close both of them off at the same time, you're going to make the person pass out. So check one and then check the other if you need to. And the most common, I find the most easiest place to check a pulse is your wrist, basically. So if you extend your wrist, you're going to see these kind of muscly feeling tendons right here. And right on the outside here, right here, you're going to feel your pulse. And even as I'm talking, I can feel my pulse. And that's why it's important to take this pulse very quickly. So practice this, practice finding your pulse on your partner and on yourself. There is a brachial pulse you can take in babies especially, but it's not something that I think you should do. If you can't find a pulse, then take your ears, put it on that person's chest, and listen really closely if you hear a heartbeat. Once you've confirmed that you don't have a pulse and you've confirmed that you can't hear a pulse, get started on CPR. Don't wait too long before that. Now that you've confirmed that they don't have a pulse, it's time to start CPR. A few things to remember about CPR is how to do it. First of all, you use the bottom of your hand right here, the hard part right here, and you can lace your hands together to give yourself some extra oomph. You do it slightly differently in children, we'll talk about that, but anybody over the age of 1 year old, you do this method. And anybody under the age of less than 1, you use your two fingers and you press down at the exact same spot on the chest. So once you find that spot on your chest and you basically get comfortable, put your hand right there and start to push down. So how far do you push down? You push down 2 inches for anybody over the age of 2 and anybody age of 1, and anybody under the age of 1, you press it down 1.5 inches. So you can measure it as you're getting comfortable. You're going to feel it. Now don't do this. Get around your back, get comfortable, get right on top of that person and start pushing down. 1, 2, 3, 4, 5. How many do you do it? So you should do it for 2 minutes and 2 minutes straight. That's about 200-ish compressions, which equals to about 100 per minute, roughly 100 to 120 per minute. There are a lot of songs that we'll put up and we'll put in the description that you can sing along to in your head that give you a good beat for that. But roughly, you're going to start counting out loud, and when you get to 200, then you check the pulse again. Now, something that we're not saying for you to do is give mouth to mouth. And latest research has shown that you don't necessarily need mouth to mouth. You can do a compressions only CPR, because the most important thing is to keep that circulation going to the heart, going to the brain, and going to the other parts of the body, and to make sure that this person, if and when you bring them back, does not have brain damage. So the 2 breaths that you give after 1 minute, don't worry about it. You just 200 compressions or 2 minutes, and then you stop, you check the pulse really quickly. Is the pulse back? Then stop doing CPR. And if the pulse is not back, continue CPR. If you have any help whatsoever, switch off every 2 minutes, because I will tell you, it will get exhausting after 2 minutes. So you want your arms to be nice and fresh for the next cycle. If you don't have anybody, unfortunately, just take deep breaths, don't lose your count, check your pulse, and make sure that you are not going to pass out from exhaustion as you're giving this person CPR. We've been saying cardiac arrest a lot, so I just want to take a quick second to explain what that is. So the difference between a cardiac arrest and a heart attack. Cardiac arrest is an electrical issue. So an electrical issue causes your heart not to beat in sync, and therefore the rest of your body is not getting blood pumped to it, which means it's not getting oxygen, and one of the most important parts of that is your brain. A heart attack, on the other hand, is basically when one of the blood vessels giving blood to your heart get blocked. And so the blood is being not pumped to your heart itself, so that it doesn't have anything to do with the rest of your body. But unfortunately, what that can do is starve the heart of oxygen, and so it can then cause an arrhythmia or a cardiac arrest, and then a person can pass out without a pulse. So just because a person is having a heart attack does not mean that they need CPR. CPR is only done if a person does not have a pulse. If they have a pulse, do not do CPR. That is CPR in a nutshell. And if you're wondering, well, that's really oversimplified, and you know, we didn't go into this and you didn't go into that. Well, truth of the matter is, when something goes wrong and you pull that person that's, you know, drowning or needs CPR off onto your deck, or somebody passes out right here, you want the least amount of things to remember as possible. Cortisol is a fickle thing, and it will make you stop thinking. So if all you remember is where to put your hands to do 200 compressions, then check the pulse. Well, check the pulse, put your hands, do the 200 compressions, and then check the pulse again, and keep doing these cycles over and over again. Your brain is going to remember that, and your brain was going to remember that because you're going to practice it. And so all of these things we talk about are going to have a recurring theme in the Medical Mondays episodes, which is practice, practice, practice. People practice man overboard drills regularly, but they never practice how to do CPR. So to me, that's just as important. So every 3 months or so, get your cushion out, sit here, and do a CPR only emergency drill. And when the time comes, you'll know exactly what to do and how to save someone's life. So we've talked a lot about pulse, or the heart rate. And again, the wrist is my favorite place to take it. Again, don't take both wrists at the same time, and don't take both pulses, carotid pulses at the same time. Just pick one and stick to it. The other basic vitals, one is respiratory rate. So you can either look at a person and count the times their chest rises to count respiratory rate, or you can take a stethoscope and listen to your back at the lungs and count every inhale or exhale. Don't count both. You want to count it for about 20 seconds and multiply it so that you get a 60-second respiratory rate. The other vital is your blood pressure. You want the blood pressure cuff in your med kit. You can get a simple one. They can get really crazy and expensive and fancy, but a simple one is all you need. I prefer the ones that go up here rather than on your wrist. Make sure that the person's arm is relaxed. Make sure that the blood pressure machine is accurately gauged and accurately on. You should know how to use this very well by the time an emergency comes around. So practice, practice, practice. The last one is the temperature. So some people may disagree with this, but as a physician, I trust the thermometer under my tongue. So I trust the temperature that is taken either under the tongue or in babies. You do have a way to take the temperature in the butt for a core temperature. And those are the two most accurate ways to take your temperature. The forehead one and the ear one, they're not as accurate. They can have variations, so it's really, really important that the one time that you do get that temperature, or the few times you get it, you get the right one. The most important thing when it comes to a medical emergency is to take a full set of vitals when you can at the beginning-ish of the emergency, and then again at the end. This gives you kind of an idea of what happened inside of the body during the whole emergency. When you're having somebody that might be having an asthma attack or had an anaphylaxis or something that is kind of an ongoing issue, an infection that you're treating, you want to take these vitals about every 6 to 12 hours because that may catch something that you might have missed. This person looks fine, but why is their heart rate and respiratory rate all of a sudden higher than it should be? And than it was 6 hours ago. Oh, maybe their asthma attack's coming back. Oh, this person had a temperature and they didn't feel warm to me at all. Oh, their infection must be really bad. I might need to get to a hospital sooner than I thought. So you never know. Take your vitals, take them regularly. Please, please, please practice. And finally, liability. Once again, not a lawyer, not official legal advice, so go do your own research. But Good Samaritan laws and maritime laws. So maritime laws are the laws that dictate the seas, basically. Whether you are a ocean-going pleasure vessel or you're a big tanker, those are the rules that apply to you when it comes to what the Coast Guard deems legal and illegal, international, what happens in international waters, etc. What maritime law has done is it has taken Good Samaritan laws, which have been passed on land, and adopted them to basically mean the same thing. And in general, Good Samaritan laws basically mean if you go to help somebody and you've done everything in your power to help them and there wasn't anything egregiously harmful you did to them, then you cannot be sued. It is a similar rule on airplanes. It is a similar rule in most countries that have adopted the Good Samaritan law, and that's another important thing, is that not every country has a Good Samaritan law, so you have to be careful. But the thing with the Good Samaritan laws, especially when it comes to maritime areas in the seas, is that it really depends whose borders you're in. So a jury in that land and the judge in that land can absolutely, if you get sued for whatever reason, can absolutely side with the person suing you, even though in theory Good Samaritan laws would have protected you. It really behooves you to understand the rules of a country that you're entering. Now, should you still help? Would you still help? That's completely up to you, I think. And another thing is, you might say, well, you're a physician, you were probably exempt from these things. And in fact, the rules and these laws are much more stricter on people who have some sort of training, like EMTs, firefighters, doctors, because, I mean, in a way, we're supposed to know better. So if you did end up harming somebody, they actually hold medical professionals to a higher standard, so you have a higher chance of maybe getting sued. But again, it really varies on what's going on. What do I think about it as a physician? I think intent is everything. I think if I see somebody in trouble, I have a full intention of helping them, and I am always going to help and do my best and use my training to help people. And if something bad happens as a result of it, it happens, but I don't ever want to go to sleep thinking I didn't help somebody who could have used my help. But make your own decisions and have fun out there. Thank you for joining, and I hope this helped. I hope this was educational, and I hope it makes you a little bit more comfortable in helping somebody when they're in trouble the next time. Be sure to check out the rest of our episodes of Medical Mondays. They are in their own little playlist, separate from our sailing videos and separate from our recipes. And we'll see you next month.